Good morning. So nice to have you join us today for 3+U. We always hope that your day is off to a good start, and today is no exception. Hopefully you're feeling good, but if you're waking up this morning with a bit of a pain in your neck, we're going to help you. Maybe not we are, but Dr. Kyle Kesler is going to help you. He is here with the Center for Sports Medicine talking about easy ways to ease that neck pain. In fact, you say nobody should have a pain in their neck.
And I totally believe that. So when it comes to pain in your neck, that's probably the most treatable thing in my world. Whether it's pain in your neck itself, pain shooting down your arm, there are ways to treat that, some simple, some not so simple, but either way, it's something we can fix.
Okay, that's music to an awful lot of people's ears. I've been one of those people, I don't know who else watching maybe has experienced the same thing, where I type a lot, or I'm on my phone in a certain way. It's ringing a bell.
Doing one of these kind of things?
Yeah, or for me it happens to be, I'm right-handed, so I'll have it always in my right arm, and then I can feel this residual pain at the base of my neck, and it is really debilitating.
For sure. Yeah, I mean, when you have pain in your neck, it's everything. You don't even think about it. Someone calls your name, you turn your head to look at them, and instantly that pain's flared up. So
the last time you were here, you brought a visual aid. You are going to be 2 for 2.
I may or may not have brought a visual aid again. So when it comes to clinic, when I'm meeting with people and talking about their neck, talking about their cervical spine, it's my world. I do that all day, every day. If there was a cereal that was spine cereal, I'd eat it. But for people who are in my office, this is something they haven't experienced. So I use a lot of visual aids, a lot of things to talk about the ways you can have trouble with your neck.
Okay.
So when it comes to your neck, you can have trouble in 3 ways. One of them is the one people think about all the time. I slept wrong, I have a crick in my neck, I turn it, it pops, it cracks. So if you were thinking about a broom, that would be, if your neck was a broom, if we were thinking about it, that would be a problem with the handle, the structure of your neck. Just like a knee, just like a hip, you can get arthritis in your neck to where you turn it, you move it, it grinds, it pops.
Okay.
That is something that does great with physical therapy. There's even injections we can do that help that. And worst case scenario, there are surgeries for that are a slam dunk. Outpatient surgery, you go home the same day, people come in feeling the best they've felt in years.
I have to pause you 1 second. So you said if it's arthritis in your neck, you're going to hear maybe a grinding or a pop.
Yep.
Some people will pop their neck. Do you know what I'm talking about?
Oh, I know exactly what you're talking about.
Is that good or bad?
It's bad. Leave your neck alone.
Will
it's
you
fragile.
high-five me, please? Okay. Continue.
Okay, so arthritis in your neck, very treatable, very common, hurts when you move it. The other one people think about a lot is pain that shoots down their arm. I slept wrong, I have a crick in my neck, when I turn it, it shoots down my arm. So with my broom example here, we were first talking about a problem with the handle, with the structure of the broom. When we're talking about pinched nerves in the neck, we're talking about pinching some of the bristles. So I have this little clamp I just put on the bristles. These bristles here are now pinched. This is pain down my right arm, shoots down into my thumb. Rest of my nerves are okay, but those nerves are pinched. Also, does great with therapy. There's injections that are super helpful. 80% of these we can get better without doing anything invasive at all.
Okay, so as you do those things, whether it's therapy or the injection, is it that little bit by little bit this pinching eases up? So if you get unpinched first?
So the therapy starts doing things like gets it to relax a little, a few of those bristles fall out to where they're not so pinched. Worst case scenario, again, an outpatient surgery, we can take all of that pressure off. Your neck is normal, you go back to functioning normal, back to your life.
All right, now there's 2 of them. What's the third
so those
one?
are the 2 common ones. The one that I wanted to bring up because people don't know about is you can also get pinched in your neck in the middle of your neck. Pinches every nerve all the way down.
Ooh.
Sometimes people don't even have pain, but these are people who are getting older. They start saying things like, I'm old, my balance is terrible, I fall a lot, my hands are clumsy, I drop things. That is not part of getting old. You may be slower, you may not be as strong, but you should be able to walk. You should be able to move your hands. So if you're ever getting those things, people start teasing you that you look drunk, even though you haven't had a thing to drink. Come see me, because that can be your neck, and again, is something we can stop the progression of if we get to it early.
To hear you talk about this, of course, this is the cereal that you would eat if there was one, so you do this all day, every day. But for most people, the idea of anything with their neck is rather frightening.
For sure.
And yet here you are talking about day procedures, outpatient procedures. This is not a long recovery time?
No, I mean, these type of things are like, I tell people 2 days, 2 weeks, 2 months. First 2 days, maybe your neck's sore, have some trouble swallowing. 2 weeks, you won't forget that you had something done, but by 2 months, people are back to their lives.
Okay. Is there anything preventive-wise to do? I have to look at myself a lot just because of my work, and I cringe because I catch myself, I lean a lot. I feel like my posture is not correct. Is good posture a good preventer?
Posture is a huge one, and then we all carry this little device that I think is designed to ruin our necks. We hold it, it's a little square, we tip our neck down like this, something like that. Definitely is the wrong position for your neck.
Up.
Hand up, rest your elbow, set your screen high on your computer. Anything that gets your head upright makes your neck last longer.
Arthritis can occur at any age?
Any age, and there's a big genetic component. So,
Really?
yes.
Okay, now to come and see you, I know Center for Sports Medicine is all over the place, so many locations. Are you housed at just a few?
I do most of my offices at the McCauley office, but we see people everywhere.
Okay.
We have non-operative people, we have physical therapy, we can get you in wherever you need to be seen, so we can come to you.
To me, the takeaway is that you don't have to live with the pain. You are confident in your ability to treat it, and not all treatments require surgery. That's pretty good.
For sure. And the only other thing I'd add is your neck is a broom.
Your neck is a broom.
There you go.
And don't be a pain in somebody else's. Center for Sports Medicine, you know where to find him. He's on McCauley Avenue. Sportmed.com is that website. 624-2696 is the phone number.